My name is Ken McDonnell. I am from Holden, Massachusetts. I'm 61 years old. I was very seriously injured. I was riding my bicycle. I'm an experienced bicyclist, triathlete for many years. I've done marathons, those sorts of activities. I was riding my bicycle on a Sunday afternoon in the fall, and I was hit from behind by a driver who had seemed to wander off the road. I was airlifted with life-threatening injuries. The doctors told my family that I had a 25% chance of surviving the first night. They saved my lifestyle here at Boston Medical Center. We chose to come here because of Dr. Tornetta. We had heard about him, about his reputation from another orthopedic surgeon.
I'm Paul Tornetta. I'm the Vice Chairman of Orthopedics and a Professor of Orthopedics at Boston University, and I run the trauma program here for orthopedics. So Ken was initially managed at an outside facility. It is fairly common actually for us to get referrals of major trauma from other hospitals, and a large part of my practice, and in fact a lot of my colleagues in the orthopedics department, is to take on some of the more challenging cases from the community where these types of resources that we've been talking about are just not available. The surgeons are of very high quality, they do wonderful work, but they don't have access to the same types of facilities that we have here at the medical center.
I sustained a traumatic brain injury, collapsed lung, several broken vertebrae, massive internal bleeding, and the injury that was most threatening of my lifestyle, I think, was the multiple fractures to my pelvis.
Well, it was quite a serious injury. He was in a high-speed accident, with a major amount of trauma to the pelvis. And you can see on his preoperative x-ray that he essentially had a split through his symphysis pubis here, where these two bones were separated. And in the back, he had a dislocation through the SI joint and partly through the sacrum.
Frankly, when I woke up after the 5 weeks in the hospital, I was completely pain-free. A lot of people refer to me as a medical miracle, largely because of the repair work that Dr. Tornetta performed.
Well, there's really no substitute for having colleagues that are good at what they do. And at a major trauma center where this is really what we do well, everything is available to me, so that if I have a challenging problem, for instance, a bad pelvic injury with bleeding, where the trauma surgeons and myself will manage that together, both in the room at the same time, making sure that everything gets taken care of appropriately. It's really just a matter of having all the pieces in place to manage these very complex problems, which is something you just couldn't do at a community hospital well, which is why most of the community hospitals will send their major trauma on to the trauma centers.
Only about a week after I finally got out of the wheelchair, I was in the pool swimming.
Yeah, I mean, Mr. McDonnell's recovery is quite remarkable. It's not the only patient like that are back to really very high level activities. But I think it's important for patients to understand that while the orthopedic surgeon can give them a good skeletal framework, something solid from which they can work, that the recovery point after that is really up to them. And Mr. McDonnell and many others that we've treated are intent on doing well. They work hard in physical therapy. They've paid attention to their instructions. And really, those are sort of the key elements to getting a full and complete recovery from a bad orthopedic injury.
I had completed a triathlon about 2 weeks before my injury, and with less than a year after the injury, I had completed another triathlon.
So Mr. McDonnell's done an outstanding job with all of his part of things, and we did a good job with ours, and together, that's the teamwork you need to get a good result.
We decided to come to Boston Medical Center. We wanted to make sure that we had the best care possible, and as it turns out, that's exactly what we received.